Hi, I'm Dr. Michael Seamer. One of the new features that we have here at Suburban Animal Clinic is dental radiology and regular radiology. The digital radiology that we have was installed about a month ago, and it has some added features that help us and help our patients. One of the things that we do is we take the screen of the x-rays and we put it into this digital processor, and the image comes up on the screen. We can then take that image and actually make some changes to it. This particular patient was done this morning. This is Biscuit. He's a 12-year-old dog that has had some GI issues, especially with vomiting lately. So one of the things that we do, this is Biscuit on his back. We can see his heart clear down his spine, through his abdomen, and down to his hips. What we're looking for is any kind of a blockage or disturbance in his GI system. We can tell on this that Biscuit has a very thickened stomach. Things are empty. There's a lot of gas buildup, probably from his vomiting that he's had the last couple days. One of the advantages of digital is that we can do some changes and make some enhancements. One of the things that we can do is actually magnify a certain area to make it show up better. So when we do this, we can magnify that and actually pull it up closer to look for any changes in detail. We can change the magnification to actually go super close, and then we can move the area that's magnified. Here's a gas pocket in the small intestine. So there are a lot of things that we could do that we could never do before with regular x-rays that we would take. So this is an enhancement that greatly improves our diagnostic capabilities, and it helps with patient care too.
Okay.
Next feature is we're going to show you another new thing that we can do with digital radiography. This is Biscuit again, the dog we just talked about. This is a lateral radiograph on his side, and what we're looking at here again is his heart, his lungs, his abdomen. Biscuit has high liver enzymes, we could tell on a blood test, and you can see that his liver is enlarged in this area where the arrow is. The other thing that we can do is actually make some differences with contrast. We can actually change the contrast, makes things darker to bring out more detail of areas and make things lighter. And this too helps with diagnostic capabilities. Biscuit has a lot of thickening in his stomach and gas buildup here, gas buildup in his GI tract, and further back. We think that Biscuit probably just has some mild liver issues and some severe gastritis. So that's what we're going to treat him for. But these are things that we couldn't do with the old x-ray system that really enhance our capability to diagnose problems. One of the things that we can do with digital radiography is that since there are no films for us to store or transport, we can take these films, they're backed up on a disk at the end of the day, and we save them forever on a disk. It also allows us to copy disk if we need to send x-rays with owners. If they need to go to a specialist, or if we need to send that x-ray to a veterinary radiologist for review, we can transfer this through a software program and actually email the x-rays to a radiologist. So it really enhances our ability to have specialists look at those and to send them with people if they have to see a specialist for other health problems. One of the differences with digital radiography is that since we don't have films to show owners on the viewers anymore, we have them on an iPad. So the software program allows us to transfer those to an iPad. We can bring the iPad in the exam room and show the owners. Biscuit, the dog we just talked about, his owner is homebound, so she can't be here. But this is what we would do. We would show the iPad. This is the x-ray of Biscuit on his side that we talked about. And one of the enhancements that we have is we can actually enlarge an area. So if we want to go to a detail like this gas pocket that Biscuit has in his GI tract, we can enlarge that. If we want to move forward to a different area, like the stomach area that has thickened from his vomiting, we can show that. So it makes it very nice to enhance areas, zoom in on certain areas, and store things for owners to show. And again, if we need to transport the information on the iPad or the radiograph, we can do that on a disc so the owners can take it with them to a specialty clinic if need be. But this has been a great service. iPads are wonderful. It's a great way to show people and a great way to look at enhancements on certain radiographs that we couldn't do before. Hi, it's Dr. Michael Seymour again here at Suburban Animal Clinic. I wanted to show you a few things about our digital dental radiography that we do. This is our dental table where we do dental cleanings and prophies and mouth and dental work on pets. We usually do those during the week, Monday through Friday. What we have here, this is our x-ray machine cone, the head of the cone of the machine. This is our anesthetic machine, and then we have part of our dental equipment over here. The veterinary technicians that we hire are all trained to do dental procedures on pets with our assistants. We do the extractions and surgical, but they do the cleaning and assess the pet for the veterinarian. One of the great things that's helpful for us is to have the ability to take dental x-rays. This is a sensor. It has a cover on it. We slip this in the animal's mouth, much like when you go to a dentist, and they take x-rays of that pet's teeth. That allows us to find a lot of hidden problems that we can't visualize. So pets too need dental x-rays like people do to help with diagnosis and treatment of their mouth problems. This is a monitor connected to the computer that's connected to the dental x-ray machine. These are digital photographs of a dog's mouth. These are all the photographs that we took of the x-rays of this particular dog's mouth, Toby. You can see that he has some special dental problems. This is a large molar tooth and a premolar, and there's a lot of space underneath where the roots and the crown are. This shows root resorption, or some resorption of gum tissue and some bone resorption. The tooth itself appears healthy here, so in this case we would try to treat this problem without extraction of the tooth. This is another picture of Toby's mouth with x-rays. This particular premolar here, there's a lot of resorption of root. This was a loose tooth, so it's a tooth that had to be extracted, and then the gums treated, some sutures in the gums to help them heal. One of the features that we can do with this is some other enhancements. We can actually make this darker, so it makes certain areas easier to see. We can make certain areas lighter. We can highlight areas. If there is a problem that we see with the mouth and the pet's teeth, oftentimes we'll print out the x-ray, highlight areas to show the owner where the pet had a dental problem. So digital radiography for mouth really helps us to treat those pets, helps us to find problems that many times we can't see. It's especially helpful in cats who have what's called resorptive lesions, which are like cavities below the gum line. Many times we cannot see those when we visualize the pet, but we can see them on the digital dental x-rays. If those are there, we know we have to extract the tooth and prevent pain in the pet's mouth. So in general, digital radiography has really helped us. It's enhanced some things that we can do for pet care, and it's allowed us to be able to transfer many of those x-rays to other people if we need to do that in the future or to get the follow-up opinion.